Dr. Amit Batra, sir, principal. He's a fellowship in stroke and neurology, National University Hospital, Singapore, American Society of Neurology certified. Over to you, sir. Please share your experience.
Hi, good evening, everybody. So, I am from Delhi and I work with Max Super Speciality Hospital, which is placed in East Delhi. So, Max has a group of around 8 hospitals across Delhi NCR, and my hospital is based in East Delhi, uh, which is a huge population base. And we are around 400 bedded hospitals, 4 neurologists working full time. So we already had a robust stroke unit in place. I had done my fellowship in stroke, so we had a lot of improvisation in the setup when I joined the unit. Uh, so when Dr. Arvind Sharma, who is a dear friend, he discussed with me the concept of this accreditation. It took time to me to get convinced that okay, this is something which we really need to do. And then, as sir also said, discussing with the administration to convince them, to show them the benefit of the accreditation, because overall it's a tedious process. But then it was, I think, worth going through this job. So we did it in October, and the good thing is that I myself got trained as an assessor 1 month prior, because luckily we had a assessor training program in Delhi. The first one was in Delhi, so I was lucky enough to attend the program spearheaded by Dr. Rana. So that gave me a lot of good insights into what the accreditation process is like, and what are the expectations from the team. So as we went through the process, one thing which emerged very strongly was that for the first time in the hospital, all of us came together as a team. So nurse in the stroke ICU wouldn't know what the nurse in the emergency is doing, right? The admin was not aware of that there are time limits for treating stroke, so it has to be done within 60 minutes, and the CT has to be done fast. So everybody was doing the job well in their own place, but once the accreditation process started, so all of us started to get together as a team, and it was really a learning process for all of us. So we used to have meetings in the department where you'd have around 30 people, including people from the administration, radiology, emergency, the OPDs, our residents, the stroke ICU team, the anesthetist, all of us. This was such a wonderful experience. The other thing was, as we went through the process, definitely there were lacunas in terms of recording the door to needle time, recording the door to CT time. So though things were done in time, but many times you couldn't produce that data to show that okay, we are thrombolizing most of the patients, the CT is being done in time. So that things also started to get improvised once we applied for the accreditation process. Once we went through that, the 2 day accreditation at the hospital, so that was another level of learning for us. The principal assessor from Ahmedabad, he was such a wonderful guy, who had spent years in this process. So it was such a great learning from him. I'll just give a short example. So we were taking him across in the outpatient, and then he saw the systems. He was very happy with it. And then he said, "Can I meet one of your girls from the front desk or the reception?" And he called that girl and asked her, uh, "How do you recognize a stroke? And what happens if a code stroke is called in the hospital?" And surprisingly, that girl was not aware of it, because even we never thought that an OPD patient can have a stroke, and we may need to call a code stroke. So we would have done that in our own OPD. We would have managed the patient well, but there was no system in place. So after the assessor pointed out this, we got into the code stroke drills in the outpatient on the floors. So that is how the stroke process has now become so well conversant in the whole hospital, including the administration. Plus it has made easy for us to convince the administration for our needs in terms of resources for stroke management, because now once they've heard it from the assessors also, they know that this is how stroke needs to be treated. And also the benefit of the accreditation is I think huge in terms of, one, you can proudly stand up and say that, I am an advanced stroke center. So maybe we are doing this work earlier also, but there was no body to recognize that. There was no way that I could have stamped that and said, okay, I am an advanced stroke center. So every center can say we are doing good work, but where is the documentation of that? So that is one. Second thing is that we came together as a team. So and that has also been now followed through. So we have monthly meetings where we review the data records. We look at, difficult stroke cases, which again was there in place, but that wasn't happening, regularly. So I think the benefit of this accreditation has been huge, and I would strongly recommend most centers, who are doing good work, to grow through this process. It takes time, it needs efforts, but I would suggest that in the end everybody will feel that it is worth it, right? So I think the more number of centers join it is going to become, I think, a nationwide wave. So I think uh, every hospital will try to vouch for it, and also try to, get through this process, so that so somebody who's not accredited will feel left out, and maybe the patient also start recognizing, like NABH or JCI, that, there is, if there is a QI accreditation for stroke, this means that this patient is going to be treated well in the hospital. So I think overall it has been a very enriching experience for us.
Thank you, sir. Thank you, Dr. Amit sir, and Dr. Mohan sir, and Dr. Kumar sir, for your wonderful experience.